Ketamine Therapy. 1. Introduction to ketamine therapy. 1.1 History and discovery of ketamine. Ketamine was first synthesized in 1962 by Calvin Stevens, a professor of chemistry at Wayne State University, and later developed by Parke-Davis Laboratories as a safer alternative to phencyclidine, PCP. Ketamine was initially used as an anesthetic agent due to its rapid onset and short duration of action, making it suitable for both surgical and battlefield applications. It was approved by the U.S. Food and Drug Administration, FDA, in 1970, primarily for anesthetic purposes. In the decades following its introduction, ketamine became widely used in veterinary medicine and emergency rooms. Its dissociative properties, which could induce a trance-like state while providing pain relief and sedation, made it valuable for surgeries and procedures requiring rapid sedation. However, these same dissociative effects also led to its abuse as a recreational drug, particularly in club scenes, under names like Special K or simply K. The transition from a purely anesthetic drug to a treatment for mental health conditions occurred in the late 1990s when researchers began to explore its antidepressant properties. Studies showed that subanesthetic doses of ketamine could produce rapid and significant reductions in depressive symptoms, particularly in patients with treatment-resistant depression, TRD. 1.2 Traditional uses in medicine. Ketamine's primary role in medicine has been as a dissociative anesthetic. Unlike other anesthetics, ketamine doesn't necessarily suppress breathing, which makes it particularly useful in emergency settings where ventilation support might not be immediately available. Its rapid action and safety profile also make it a preferred anesthetic for children and patients with respiratory issues. In addition to its anesthetic properties, ketamine has been used in the management of acute pain. It is particularly effective for pain that is resistant to opioids, such as in cases of complex regional pain syndrome, CRPS, or severe burns. Its ability to interrupt the transmission of pain signals at the spinal cord level provides significant relief in chronic pain conditions. 1.3 Transition to therapeutic use. The discovery of ketamine's potential as a treatment for mental health disorders marked a significant shift in its application. The landmark study by Yale University researchers in 2000 demonstrated that a single intravenous infusion of ketamine could produce rapid antidepressant effects in patients with TRD. This finding was groundbreaking, as traditional antidepressants typically take weeks to show effects, and many patients with TRD do not respond to them at all. This discovery led to a surge in research exploring ketamine's effects on various mental health conditions, including anxiety disorders, post-traumatic stress disorder, PTSD, and bipolar disorder. The therapeutic potential of ketamine was not only limited to depression, it was soon found that ketamine could also help alleviate suicidal ideation quickly, which opened new avenues for its use in psychiatric emergencies. 2. What is ketamine? 2.1 Chemical structure and properties. Ketamine is a phencyclidine, PCP, derivative with the chemical formula C13H16ClNO. It is classified as a non-competitive N-methyldiaspartate, NMDA, receptor antagonist, meaning it inhibits the action of the NMDA receptor, which is involved in the transmission of pain and the regulation of mood and cognition. The molecule exists in two enantiomers, S-ketamine and R-ketamine. The S-enantiomer is often considered more potent in its anesthetic and antidepressant effects. The nasal spray form of ketamine, approved by the FDA for treatment-resistant depression under the brand name Spravato, contains S-ketamine, the S-enantiomer. 2.2 Mechanism of action. Ketamine's therapeutic effects are primarily attributed to its action on the NMDA receptors in the brain. By blocking these receptors, ketamine disrupts the usual flow of glutamate, a neurotransmitter that plays a key role in mood regulation, learning, and memory. This disruption leads to a cascade of events that ultimately result in increased synaptic plasticity, the formation of new neural connections, and the strengthening of existing ones. In addition to its action on NMDA receptors, ketamine also interacts with other receptors, including opioid receptors, serotonin receptors, and AMPA receptors. These interactions contribute to its complex pharmacological profile and its ability to produce rapid antidepressant effects. One of the most intriguing aspects of ketamine's mechanism is its ability to induce neuroplasticity, particularly in areas of the brain associated with mood regulation. regulation, such as the prefrontal cortex and hippocampus. This neuroplasticity is thought to underlie the rapid and sustained antidepressant effects observed in patients following ketamine administration. 2.3 different forms and administration routes. Ketamine can be administered in several forms, each with distinct pharmacokinetics and therapeutic implications. Intravenous, 4, ketamine, the most studied and commonly used form of ketamine for mental health treatment. For ketamine is typically administered as a slow infusion over 40 minutes. This method allows for precise control over dosing and rapid onset of effects. Intramuscular, IM, ketamine, administered as an injection into the muscle, IM ketamine provides a rapid onset of effects, similar to 4-ketamine, but with less control over the dosing. It is often used in emergency settings or when 4-access is not available. Oral ketamine, available in liquid or pill form, oral ketamine is less commonly used for therapeutic purposes due to its lower bioavailability and slower onset of action. However, it can be useful for long-term pain management. Nasal spray, esketamine nasal spray, marketed as Spravato, is an FDA-approved treatment for TRD. It allows for self-administration under the supervision of a healthcare provider, providing a more convenient and less invasive option than 4 or IM ketamine. Sublingual and rectal forms, these are less common but can be used in specific situations where other routes of administration are not feasible. 3. Ketamine in mental health treatment. 3.1 Early research and discoveries. The early 2000s saw a surge in research into ketamine's potential as an antidepressant, sparked by the Yale study that demonstrated its rapid and significant effects on depression. Researchers were intrigued by the possibility of a treatment that could alleviate depressive symptoms within hours, rather than the weeks required by traditional antidepressants. Subsequent studies replicated these findings, showing that ketamine could reduce symptoms of depression in patients who had not responded to other treatments. These effects were often seen within hours of administration and could last for up to 2 weeks after a single infusion. 3.2 Mechanism in treating depression. Ketamine's antidepressant effects are believed to be mediated by its action on the NMDA receptors, leading to increased glutamate release and activation of AMPA receptors. This process results in a surge of brain-derived neurotrophic factor, BDNF, which promotes the growth and survival of neurons and the formation of new synapses. The rapid onset of antidepressant effects is thought to be due to ketamine's ability to reset dysfunctional neural circuits in the brain, particularly those involved in mood regulation. This reset effect is what makes ketamine particularly effective in treatment-resistant cases, where other antidepressants have failed to produce results. 3.3 Efficacy in treatment-resistant depression, TRD. Treatment-resistant depression, TRD, is defined as depression that does not respond to at least 2 different antidepressant treatments. TRD affects a significant proportion of individuals with depression, and finding effective treatments for this population has been a major challenge in psychiatry. Ketamine has emerged as a promising option for TRD, with studies showing response rates of up to 70% in some patients. The rapid onset of action is particularly valuable in cases where immediate relief is needed, such as in patients with severe depression or suicidal ideation. The duration of ketamine's antidepressant effects varies, with some patients experiencing relief for a few days to weeks. For sustained benefits, repeated infusions or maintenance treatments with esketamine nasal spray may be necessary. Research is ongoing to determine the optimal dosing schedules and maintenance strategies for long-term management of TRD with ketamine. 3.4 Use in anxiety disorders. Beyond its use in depression, ketamine has shown promise in treating various anxiety disorders, including generalized anxiety disorder, GAD, social anxiety disorder, and obsessive-compulsive disorder, OCD. The anxiolytic effects of ketamine are thought to be related to its action on glutamate and NMDA receptors, as well as its ability to enhance neuroplasticity. Preliminary studies have shown that ketamine can reduce symptoms of anxiety within hours, with effects lasting for several days. This rapid response is particularly beneficial for patients with severe anxiety that interferes with daily functioning. However, the use of ketamine for anxiety disorders is still in the early stages of research, and more studies are needed to fully understand its efficacy and safety in this context. 3.5 Ketamine in PTSD. Post-traumatic stress disorder, PTSD, is a debilitating condition that can result from exposure to traumatic events. Traditional treatments for PTSD, such as psychotherapy and medications, are often only partially effective, leading researchers to explore alternative options like ketamine. Ketamine's effects on PTSD are thought to be mediated by its ability to disrupt maladaptive neural circuits and enhance synaptic plasticity, allowing the brain to form new, healthier connections. Studies have shown that ketamine can reduce symptoms of PTSD, including flashbacks, hyperarousal, and avoidance behaviors, often within hours of administration. While ketamine is not a cure for PTSD, it can provide rapid relief from symptoms, allowing patients to engage more effectively in therapy and other long-term treatments. Research is ongoing to determine the best protocols for using ketamine in the treatment of PTSD, including dosing schedules and the potential benefits of combining ketamine with psychotherapy. 4. Ketamine-assisted psychotherapy, KAP. 4.1 Overview of the therapeutic process. Ketamine-assisted psychotherapy, KAP, is an emerging approach that combines the pharmacological effects of ketamine with the therapeutic benefits of psychotherapy. In KAP, ketamine is used as a catalyst to deepen the therapeutic process, helping patients access and process difficult emotions, memories, and thoughts. The KAP process typically begins with a thorough assessment by a qualified therapist or psychiatrist, who evaluates the patient's mental health history, current symptoms, and suitability for ketamine therapy. If deemed appropriate, the patient undergoes a series of ketamine sessions, each followed by integration therapy to help process the experiences and insights gained during the ketamine sessions. 4.2 Combining ketamine with psychotherapy. The combination of ketamine and psychotherapy can be particularly powerful for patients with complex or treatment-resistant conditions. Ketamine's ability to induce a dissociative state can help patients step outside of their usual thought patterns and gain new perspectives on their problems. This can be especially helpful in psychotherapy, where the goal is often to uncover and address underlying emotional and psychological issues. During a KAP session, the patient typically receives a low dose of ketamine, either via 4 infusion, IM injection, or oral administration. The session is conducted in a controlled, therapeutic environment, with the therapist guiding the patient through the experience. The dissociative effects of ketamine can facilitate a deep, introspective state, allowing the patient to access repressed memories, emotions, or insights that may be difficult to reach in a regular waking state. After the ketamine session, the therapist works with the patient to integrate the experience into their overall treatment plan. This integration process is crucial for translating the insights gained during the ketamine session into lasting therapeutic change. 4.3 Patient experiences and case studies. Patient experiences with KAP can vary widely, depending on the individual's mental health condition, the dosage of ketamine used, and the therapeutic approach taken. Many patients report profound, life-changing experiences, characterized by a sense of clarity, emotional release, and newfound understanding of their issues. Case studies have documented the use of KAP in treating a range of conditions, including TRD, PTSD, and anxiety disorders. For example, one case study described a patient with severe TRD who experienced a significant reduction in depressive symptoms and suicidal ideation after a series of KAP sessions. The patient reported that the ketamine sessions helped them confront and process long-standing emotional trauma, leading to a sustained improvement in their mood and overall functioning. While these individual case studies are promising, more research is needed to systematically evaluate the efficacy of KAP and determine the best practices for its use in different populations. 4.4 Current research and findings. Research on KAP is still in its early stages, but preliminary findings suggest that it can be an effective treatment for a range of mental health conditions. Studies have shown that KAP can lead to rapid reductions in depressive symptoms, particularly in patients with TRD. There is also evidence to suggest that KAP can be beneficial for patients with PTSD and anxiety disorders. One of the key areas of ongoing research is the role of the therapist in KAP. The therapeutic relationship is thought to be a crucial component of the treatment, with the therapist serving as a guide and support throughout the ketamine experience. Researchers are also exploring the optimal dosing and scheduling of KAP sessions, as well as the potential benefits of combining KAP with other therapeutic modalities, such as cognitive behavioral therapy, CBT, or mindfulness-based therapies. 5. Ketamine for chronic pain management. 5.1 Mechanism of action for pain relief. In addition to its use in mental health treatment, ketamine has long been recognized for its analgesic properties. Its mechanism of action in pain relief is primarily related to its antagonism of NMDA receptors, which play a crucial role in the transmission and modulation of pain signals in the central nervous system. By blocking NMDA receptors, ketamine prevents the transmission of pain signals and reduces central sensitization, a condition where the nervous system becomes overly sensitive to pain stimuli. This makes ketamine particularly effective in treating chronic pain conditions that are resistant to other forms of treatment, such as opioids. 5.2 Conditions treated with ketamine. Ketamine is used to treat a variety of chronic pain conditions, including complex regional pain syndrome, CRPS. CRPS is a chronic pain condition characterized by severe, burning pain, usually in the limbs. Ketamine has been shown to provide significant pain relief in patients with CRPS, often when other treatments have failed. Fibromyalgia. Fibromyalgia is a condition characterized by widespread musculoskeletal pain, fatigue, and tenderness in specific areas of the body. Ketamine has been found to reduce pain and improve quality of life in patients with fibromyalgia, particularly when used as part of a comprehensive pain management plan. Migraines. Ketamine has been used to treat severe, refractory migraines that do not respond to standard treatments. Its ability to disrupt pain signals and reduce central sensitization makes it an effective option for some patients with chronic migraines. Neuropathic pain. Neuropathic pain, caused by damage to the nervous system, can be particularly challenging to treat. Ketamine's action on NMDA receptors and its ability to modulate pain pathways make it a valuable tool in managing neuropathic pain. 5.3 Efficacy in case studies. The efficacy of ketamine in chronic pain management has been supported by numerous studies and clinical trials. For example, a study published in the Journal of Pain Research found that ketamine infusions provided significant pain relief in patients with CRPS, with some patients experiencing long-lasting reductions in pain intensity. Another study in the Journal of Anesthesia and Analgesia reported that ketamine infusions significantly reduced pain and opioid consumption in patients with chronic pain conditions, including fibromyalgia and neuropathic pain. The study also highlighted the potential for ketamine to improve mood and quality of life in these patients, further supporting its use as a multimodal treatment for chronic pain. Case studies have also documented the successful use of ketamine in managing chronic pain. For example, one case study described a patient with severe, refractory migraines who experienced significant pain relief and improved daily functioning after a series of ketamine infusions. The patient reported that the ketamine treatments allowed them to return to work and engage in activities that had previously been impossible due to the debilitating nature of their migraines. 6. Ketamine clinics and accessibility. 6.1 Growth of ketamine clinics worldwide. As the therapeutic potential of ketamine has become more widely recognized, there has been a rapid growth in the number of ketamine clinics worldwide. These clinics offer ketamine treatments for a range of conditions, including depression, anxiety, PTSD, and chronic pain. The growth of these clinics has made ketamine therapy more accessible to patients who may not have had other treatment options. Ketamine clinics vary in their approaches, with some offering standalone ketamine infusions, while others incorporate ketamine into a broader therapeutic framework that includes psychotherapy, lifestyle interventions, and other treatments. The growth of these clinics has also led to the development of new business models, including membership-based services, concierge care, and telemedicine options. 6.2 Regulations and Guidelines. The rapid expansion of ketamine clinics has raised important questions about regulation and oversight. While ketamine is an FDA-approved drug for anesthesia, its use in mental health treatment is considered off-label, meaning it is not specifically approved for this purpose by regulatory agencies. As a result, there is significant variability in how ketamine is administered and monitored across different clinics. To address these concerns, professional organizations and regulatory bodies have begun to develop guidelines for the use of ketamine in mental health treatment. These guidelines typically emphasize the importance of thorough patient assessment, informed consent, and careful monitoring of side effects. They also recommend that ketamine treatment be conducted in a controlled, therapeutic environment, with appropriate medical supervision. 6.3 Cost and insurance coverage. The cost of ketamine therapy can vary widely, depending on factors such as the location of the clinic, the dosage and frequency of treatments, and whether additional services, such as psychotherapy, are included. In general, ketamine infusions can be expensive, with costs ranging from several hundred to several $1,000s per session. One of the major barriers to access for ketamine therapy is the lack of insurance coverage. Because ketamine is often used off-label for mental health conditions, many insurance companies do not cover the cost of treatment. This can make ketamine therapy prohibitively expensive for some patients, particularly those who require multiple sessions. However, there are efforts underway to increase insurance coverage for ketamine therapy. Some clinics have begun to work with insurance companies to develop coverage options, and there is growing advocacy for the recognition of ketamine as a legitimate and necessary treatment for certain mental health conditions. 6.4 Accessibility issues and barriers to treatment. In addition to cost, there are other barriers to accessing ketamine therapy. Geographic location can be a significant barrier, particularly for patients in rural or underserved areas where ketamine clinics may not be available. Additionally, the stigma associated with mental health treatment and the use of a drug like ketamine can deter some patients from seeking care. To address these barriers, some clinics have begun to offer telemedicine services, allowing patients to receive ketamine treatment remotely. There are also initiatives to increase public awareness and education about ketamine therapy, with the goal of reducing stigma and increasing access to care. 7. Side effects and risks of ketamine therapy. 7.1 Common side effects. Like any medication, ketamine can produce side effects, particularly at higher doses. Common side effects include dissociation, a feeling of being detached from reality, often described as an out-of-body experience. While this effect is often sought after in recreational use, it can be unsettling for some patients in a therapeutic setting. Nausea and vomiting, these are common side effects of ketamine, particularly when administered intravenously. Anti-nausea medications can be used to mitigate these effects. Dizziness and drowsiness, these effects are typically mild and resolve shortly after the ketamine infusion. Increased blood pressure and heart rate, ketamine can cause a temporary increase in blood pressure and heart rate, which may be concerning for patients with cardiovascular conditions. Monitoring is usually conducted during the infusion to ensure safety. Blurred vision, some patients may experience blurred vision or visual disturbances during or shortly after the ketamine infusion. 7.2 Psychological risks. While ketamine can have profound therapeutic benefits, it also carries psychological risks, particularly in vulnerable populations. Some patients may experience worsening of psychiatric symptoms, such as anxiety, paranoia, or hallucinations, particularly if they have a history of psychosis or other severe mental health conditions. There is also a risk of ketamine-induced flashbacks or the emergence of repressed traumatic memories, which can be distressing if not properly managed. For this reason, it is crucial that ketamine therapy be conducted under the supervision of a qualified therapist or psychiatrist who can provide support during and after the treatment. 7.3 Long-term risks and dependency concerns. One of the major concerns with long-term ketamine use is the potential for dependency or abuse. While ketamine is not considered highly addictive in the same way as substances like opioids or benzodiazepines, there is evidence to suggest that frequent use can lead to tolerance, dependence, and addiction, particularly in individuals with a history of substance abuse. Chronic use of ketamine can also lead to other health issues, such as urinary tract problems, known as ketamine bladder syndrome, and cognitive impairments. These risks highlight the importance of careful monitoring and adherence to prescribed dosing schedules. 8. Future directions and emerging research. 8.1 Potential new applications. The growing body of research on ketamine has led to interest in its potential applications beyond the treatment of depression and chronic pain. Some of the emerging areas of research include Substance use disorders. Preliminary studies suggest that ketamine may help reduce cravings and withdrawal symptoms in individuals with substance use disorders, particularly alcohol and opioid dependence. This has led to interest in the potential use of ketamine as part of addiction treatment programs. Bipolar disorder. While ketamine is primarily studied in the context of unipolar depression, there is emerging evidence to suggest that it may also be effective in treating depressive episodes in bipolar disorder. However, the risk of inducing mania remains a concern, and more research is needed in this area. Obsessive-compulsive disorder, OCD. Early research suggests that ketamine may help reduce symptoms of OCD, particularly when combined with traditional treatments like cognitive behavioral therapy, CBT. 8.2 Advances in administration and delivery methods. Researchers are also exploring new methods of administering ketamine to improve its efficacy and reduce side effects. Some of the areas of interest include sustained-release formulations. Sustained-release formulations of ketamine, such as transdermal patches or implants, could provide a more consistent and controlled release of the drug, reducing the need for frequent infusions. Combination therapies. Combining ketamine with other medications or therapies, such as antidepressants, antipsychotics, or psychotherapy, may enhance its therapeutic effects and reduce the risk of side effects or dependency. Personalized medicine. Advances in genetic and biomarker research could lead to more personalized approaches to ketamine therapy, allowing clinicians to tailor treatment to the individual patient's needs and response. 8.3 Ethical and legal considerations. As ketamine therapy continues to grow in popularity, there are important ethical and legal considerations that must be addressed. These include issues related to informed consent, patient autonomy, and the potential for coercion or exploitation in vulnerable populations. There is also ongoing debate about the off-label use of ketamine in mental health treatment and the need for more rigorous regulation and oversight. Ensuring that ketamine therapy is conducted safely, ethically, and in the best interest of the patient will be crucial as the field continues to evolve. 9. Conclusion. Ketamine therapy represents a significant advancement in the treatment of mental health conditions and chronic pain, offering hope to patients who have not responded to traditional treatments. Its rapid onset of action, combined with its ability to induce neuroplasticity and disrupt maladaptive neural circuits, makes it a powerful tool in the therapeutic arsenal. However, ketamine therapy is not without its challenges and risks. Careful patient selection, monitoring, and adherence to established guidelines are essential to ensuring its safe and effective use. As research continues to advance, ketamine may find new applications and become an even more integral part of mental health and pain management. The future of ketamine therapy is promising, but it will require ongoing collaboration between researchers, clinicians, and policymakers to fully realize its potential while minimizing the risks. With continued research and careful implementation, ketamine therapy could play a transformative role in the treatment of some of the most challenging conditions in medicine. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.